Hello and welcome to Workforce Wisdom. I'm your host, Christy Bray, Chief Customer Officer at PracticeLink. This podcast explores the latest trends in healthcare recruitment, highlighting innovative strategies, success stories, and fresh perspectives that are transforming the healthcare workforce. These episodes will lead to in-depth, thoughtful discussions with recognized industry-leading healthcare professionals, exploring the challenges of healthcare recruitment and beyond. Whether you're an experienced recruitment professional or just starting, this podcast aims to help you discover how experts are reshaping the industry, leveraging technology, and fostering inclusive hiring practices. Today's episode, How Video and AI Strengthen Recruitment, Retention, and Culture, with Deborah Mitchell. Deborah Mitchell is an Emmy-nominated TV producer, video marketing strategist, and AI consultant, with decades of experience crafting story content that informs, inspires, and builds authority. Her background includes co-hosting the Geraldo TV show along with Geraldo Rivera and producing for CBS News. In 1998, she served as executive producer of Women and Children First on America's Health Network, a health-focused TV channel broadcasting from Universal Studios in Orlando. Those years taught her how to shape complex ideas into clear, compelling stories under real pressure and tight deadlines. Skills she now brings directly to you and your brand. From her network hits, documentaries, and celebrity interviews to digital series and podcast content, she has spent her career shaping stories that grab attention and create impact. Today, through her signature video visibility method, she has merged classic TV storytelling with AI video tools so you can show up confidently, clearly, and consistently online. Debbie, welcome. I'm so glad to interview you today.
Oh my gosh, Christy, it's so nice to be here. Thank you for having me.
Absolutely. So you've held some pretty influential leadership roles in media and doing this organizational consulting. Was there a pivotal experience or moment that set you on a path towards leadership development and consulting?
Well, as you mentioned in my bio earlier, I spent many years working with different professionals and leaders as a television producer, putting them on national television shows. So that was a great ramp up for me to make the transition, make the professional pivot in 2020 during the pandemic when everyone was at home and we had to figure out how to still have a presence where we could no longer be in person and we were stuck online Zooming everybody. And I thought I could use my skills. I could use my TV skills and make that online presence more interesting and more dynamic and show leaders how to build a presence online, make their online presence the stage that they needed. And so that's one of the main ways that I made the pivot to working with leadership online.
Yeah. And I think that's becoming more and more important as we were chatting before we started recording. What we consume now, it isn't so much face-to-face. A lot of it, what you're trying to build either in your brand or your company ends up being that type of communication, having that clear and concise, consumable information.
Yeah. And the fact that we can now have more control of how we watch content. When I first got into television, we had our few networks and we had designated TV times to watch and we had to be in front of the television. Now everything is on our phone, on our smartphone. So we can watch, we have it in the palm of our hands. We can watch whatever we want, whenever we want, wherever we are. And that has totally changed the landscape. Walls have come down as far as how we consume content, produce content. And it's a great way for everyone. I think everyone should have a brand and you can control your brand. So you can do a lot of that through with video. It's a no-brainer as far as I'm concerned.
Yeah. Yeah, I fully agree. What are some of the core lessons that you've carried with you, into this transition, your current work as a leadership strategist and executive coach?
Oh, wow. First of all, producers are great multitaskers. So we know how to research. We see the value in storytelling and using video to humanize yourself, your brand. People really feel that they know you better. So it's all about knowing, liking, and trusting individuals. And it's the best way, I think the greatest way to establish that know, like, and trust, whether you're an entrepreneur trying to get business clients or you're a doctor trying to establish a relationship with your patients.
Hmm.
Because you meet your patient when you first come in at the appointment, and you're just talking to a stranger. If you have a presence online and
Hmm.
a patient can look you up and see who you are, learn a little bit more about you, that's definitely, you're walking into a warmer room once they've had a chance to look at you beforehand. So I think that that's one of the main biggest lessons that I've learned: storytelling.
Hmm.
Tell your story.
And I think one of the things early on, maybe not early on, but 15 years ago, health systems did a lot of work to try and clean up some of that online presence for their physicians and their providers, because there were several tools coming out in the market, providing a rating system. And so really
Mm-hmm.
having to be actively involved, knowing what's online, what is out there online about you. Now that's probably shifted, you can go on Reddit and
Mm-hmm.
read what other people think in that type of kind of open forum. It can be scary sometimes, but I think, trying to make those adjustments either in your brand, your messaging, and making sure the
Mm-hmm.
true you is out there. I think that could be very valuable for physicians.
Absolutely. I've had quite a history with doctors myself. So I'm actually approaching this work as not only a producer strategist, but also as a patient. So I'm always keeping that in mind. And when I go in to choose a doctor and meet a doctor, I'm unfortunately putting on my producer lens, my producer hat. So I have questions. And most people, I think, go into doctors, they're afraid to ask questions, or they don't think they should ask questions. And so when I meet a doctor who says to me, do you have any questions? And they're really interested in hearing my concerns. It makes such a difference. So this doctor that I recently had, because I just had hip replacement surgery, and before I chose him, I actually went online and he had a video. And it was such a moving video that it made the deal for me. I said, okay, this is the guy who I'm going to use. Hmm.
Yeah, no, that is some great advice. The websites, I think, end up being that portal into getting to know someone.
Hmm.
You often speak about helping leaders unlock their potential. What are the
Hmm.
most common barriers you see that are holding leaders back? Maybe if you think about either that physician leader or even within an organization that's really trying to provide this high level of care and take care of their community.
For any leader who is thinking about connecting with their target audience or their community, it's really about doing a survey. Ask the questions, figure out the pain points of the community, of the people who you are working with, or the community who you're trying to serve, and find out what their pain points are and then address them. Don't guess. Don't try and guess what you think they want. Go out and ask them. So whether you're sending out regular surveys, you have maybe questions on your website that you have them answer, or they can download questions, but don't guess, do a survey, because data is really important. So once you get the information of those pain points, then you can address them.
Mhm. So, in your experience, what distinguishes a healthy organizational culture from one that is simply functioning?
Oh, that's a great question. I'm going to go back to think about my network years. What was healthy? But any corporation, I think that employees should feel comfortable expressing themselves.
Hmm.
You really have to have a safe space that you can talk and not only talk but feel that you're being heard. So whatever you're bringing, whatever concerns you might have that you're bringing to the table, or ideas, it doesn't have to be bad, it could be good, but that it's being considered and it's being heard. And then once the idea is put out there or the concern is put out there, someone circles back to you
Right.
and address it and responds to what you've talked about. You should really be heard.
Yeah. And I will say, I mean, nothing degrades that culture faster than when you do have people providing ideas.
Mm-hmm.
Every idea is a good idea, but not every idea can be implemented. And so, as you said, circle
Mm-hmm.
back and explain the why, or maybe instead of, it provided that spark for the organization to think about it a little bit differently, but they may not be able to do to do what was provided in that idea.
And they might not be able to do it in this moment. They, maybe in the future, but definitely get back to the person
Yes.
and let them know that they were heard. Hmm.
So as you work with these leaders and organizations, coaching them, and they make this commitment to that
Hmm.
transformation, where do you recommend they begin? Culture? Is there another area that you kind of say, let's do that first?
Oh, you use a really important word in that question, commitment. You got to commit.
Yep.
And you commit and you start out with coming up with a plan and then a strategy and then you execute. So because I'm dealing with helping them to feel comfortable creating video, which I love video because it lasts forever.
Hmm.
You have it. Like I said, you could put it online. You can have a YouTube channel. You can create, as you have a podcast here, you're creating great content. And this is content that can be used as a way to promote what your organization is about,
Hmm.
and you can send it out. So I think that video is a great way. So to get started with video, you have to have the visibility, feel comfortable on camera. What I hear from a lot of people is they don't feel comfortable on camera.
Hmm.
They don't have the time. We know everyone's very busy. They don't have the budget. So there are definitely some top three reasons people don't create the content. But those are the things that you have to look at and figure out how you could move forward. So when it comes to creating video, some people who don't like the way they look on camera and they're nervous about being on camera. AI has totally come in, and so there are so many tools now that you can have faceless videos. You don't need to be on camera to
Hmm.
actually say your message, give your message. If you don't like your voice, there's software that you can change your voice, use another voice. There's an answer to everything now with AI, making it so easy. And as far as time, it doesn't have to take a lot of time. You just need to be organized.
Hmm.
Get organized, decide that you're going to record a certain amount of video, what the topic is, why you're recording it, who it's for, and make the time to do that.
Yeah.
Those are some of the top three things that I've heard, or reasons why people don't get started.
Right. And I think the key we started with was that commitment. So after those leaders have made, they've committed, they've scheduled the time, they have the content. What else, or how can they keep that moving forward?
Well, they have to decide that they're going to be consistent with the content. So that's the other thing. And practicing comes in very good, I think, especially in the area of healthcare. We know that doctors, they're good at what they do,
Hmm.
but they need to, I feel what would help is to, again, humanize it and make it more palatable. So if they're going to go on camera, they need to think about what is the message that they want their patients to know. What questions do they feel comfortable answering, letting their audience get an inside view of them aside from their technical skills.
Hmm.
So share a little personal information, personalize yourself. So those are the things that I would start off with as
Hmm.
far as getting comfortable on camera and deciding what type of content to put out.
Yeah. So I know you use, the video platform. It's what we've talked about quite a bit. How do you get that video platform to really help that executive to promote or create that sense of belonging and psychological safety
Oh,
for that engagement, either their patients or their employees, that really leads to that retention for those folks?
okay. So belonging is very important. And we talked a little bit about that earlier in our conversation, where an individual needs to feel as though they are heard, they feel safe in the space, that they are one of the team. Because you go farther as a team,
Hmm.
and you want people to you want that team mentality. So you're trying to create that. So everyone needs to feel that they are contributing somehow, some way to the team. So you need to be aware of the people in your space, in your team who are working with you, for you, and make time, whether it's 10 minutes or 20 minutes, get to know that person a little bit, talk to them. It's
Hmm.
all about communicating. And so people want to feel as though you care. And
Hmm.
whether you're a patient and a doctor caring for a patient or a leader caring for their staff. I've worked in a few places where we were like one big family.
Sure.
And you really, that's a nice feeling. So if you can somehow make that feeling. And some large organizations, you really can't do that, but it's important to try and make people feel connected to each other.
Yeah, no, I think that's great. I've been a remote employee for well over a decade, and it can be challenging both as the employee and as the leader, how you can do that. Video, obviously,
Hmm.
we have a lot of means of communication. It's using them appropriately with intent. And like you said, like commit to doing those things to continue to create that culture.
Yes, absolutely. And the remote work, my team is remote, and I have a scheduled meeting every Monday and Friday.
Hmm.
And if it's, I try to get at least a half an hour together.
Sure.
And at the top of the meeting, we check on how we're doing, and then we get into business. But we're at least seeing each other. We're hearing what's going on. And that's a way to stay connected. I don't think the only thing that you don't have is the coffee cooler to gather around like you used to back in the day.
Right. Right.
But you can still stay connected.
Yeah. Virtual
Hmm.
coffee time. Yeah.
Exactly. Exactly.
Yeah. So based on your experience coaching leaders and helping organizations navigate complex workforce dynamics, what strategies have you seen most effective in reducing burnout, strengthening engagement, which you talked a lot about so far? Anything specific related to video as you do that work with those leaders?
Oh, well, again, that's a little tricky. When you're talking about burnout, I think that everyone's trying to have a lifestyle.
Hmm.
They're trying to have a balanced lifestyle. So it's important to be aware of what's going on in people's lives outside of work as much as they want to share. I told you I'm a caregiver. I don't really talk about it with my clients, but I'm speaking more about it because it's a big topic in the news, and I think everyone goes through it and will go through it. So I'm comfortable now sharing a little bit more. But if you're able to have an employee or people on your team talk a little bit about what's going on outside of the work, that's a type of caring and concern that's important. People want to feel as though, okay, they do care about me.
Yeah. I think that really was evident. I know, COVID, working in healthcare here in
Hmm.
Nashville, was some of my team was here, but most were not. They're spread out across the country, getting to see inside people's homes for the first time.
Hmm.
It gave us a really cool insight, I felt like, because I never would probably go into their home normally, go into hospitals all the time, but not somebody's house. And I think that was actually a very cool part of, being able to, be invited in that way through video.
And you relax, yeah. And we talked earlier about people feeling the need to be perfect in order to be on video. You can't.
Yeah.
That's too much pressure. You're putting too much pressure on yourself. So in this conversation, you could hear my mom in the background. That could happen.
Sure.
And there was a time where I would have been worried, but I said it's life. So you'll know that's a part of my life. Yes. Hmm.
Yeah, I know, absolutely. My office is by my front door, and it does not matter how many times I tell my children I'm recording, use the garage. They are always coming in through the front. And so, it is life. I think what you said is lifestyle ends up being some of the pieces that can help with that burnout. And as a leader, just doing all that you can to help support them. It's going to be different for every
Hmm.
employee or every
Yes.
patient. It will look different for everyone, which is a struggle,
Yes.
but it's
Hmm.
important to take that to make those focused efforts.
Absolutely. We're all humans. And that again goes back to the humanizing doctors and professionals.
PracticeLink is evolving. Our commitment is clarity, simplicity, and trust, delivered steadily instead of disruptively, and built to support better recruiting outcomes over time. Learn more at PracticeLink.com.
Obviously, your change happened during COVID, lots of
Hmm.
significant change there. But as you've worked with leaders across industries, how do you see the future of that leadership evolving as generational expectations shift talked a little bit about the hybrid or remote work becoming standard. And then really those employees increasingly seek purpose-driven, value-aligned workplaces.
Yeah, yeah. We have to look at this generation that's coming up. I have doctors who are on both ends. I have my older doctor who's getting ready to retire.
Mhm.
And then I have my younger doctor. And so what's kind of neat with my older doctor, he says, he gave me his cell phone number. He said, if you need anything, call me. I was so shocked. I was like, what? So, but the younger generation are coming up and things are moving so quickly, whether it's AI, how they absorb information, how they connect with each other. And it's going to be up to the established generation to understand how to communicate and relate to this younger generation that they're bringing in. They move differently. So we have to keep our skills up as an organization, you know, making sure that your employees are getting the skills that they need so that they can relate to this new generation coming in, take classes, implement tools, look at the tools that you have in place and how you can bring them up to speed, and all of that is really important because it is happening very quickly.
Mhm.
And I'm just stunned at how things are moving. So and this is what this younger generation, they know. So they're going to want that wherever they go, wherever they're working.
I thought about it the other day. I have not done the math, but the generation of physicians that are starting practice now, they were YouTube kids. So my
Mhm.
kids are more TikTok kids. So, have to shift
Mhm.
towards that as they start going out into the workforce. But for leaders, you have to think about that, how will you reach them? Different generations, they want a postcard mailed to their house or a billboard on the highway. That
Mhm.
connectivity is different. I think that's kind of why, marketing, you say you have to send the message, 7 different times, 7 different ways, or maybe it's 12 different times now, but
It's 11. Yeah.
11, yeah, the
Mhm.
multiple touch points in terms of your
Mhm.
media and outreach.
Yeah. Absolutely. One of my main clients, Dr. Mark Plotkin, we started his podcast during the lockdown, and he's older, and his daughters were the one who encouraged him to start the podcast. And we started it, and it's done so well. We've gone into 7 seasons, and we've had over 1 million downloads. But the success of the podcast, and again, it was his daughters encouraged him to start it, that younger generation.
Mhm.
So we have that as long form video. He has his YouTube channel. Everyone, I think, should have a YouTube channel. The chairman of YouTube was just named Man of the Year for Time Magazine. YouTube is where it is. So you
Yeah,
should have a YouTube channel.
yeah.
So yeah, it's definitely how this generation is consuming content,
Mhm.
and you want to be a part of it.
Yeah. No, that's great. Congratulations to him and you for
Yeah.
supporting him on that podcast.
Oh, thank you. That was great. He's been great. And you as a producer, I have had to adapt. Many leaders who come in, they are smart at what they do.
Mhm.
And you cannot deny that. They're an expert. And sometimes they don't want to take instruction right away. They will come into their own, but it takes time. And that's where my patience comes in. I was like, okay, let's do it your way. And then let them get comfortable.
Sure.
And then we'll see what happens. And they loosen up, they trust. That's where the know, like, and trust, because I'm not going to mislead you. I'm going to give you the same direction that I would give an anchor at a network that they followed. I'm going to give to you, and trust me, it's going to work. So give them time to relax into it, and it's going to work out.
Yeah, absolutely. You work closely with executives through coaching and leadership development. What themes or challenges are showing up most often right now?
Oh, well, that just kind of plays into what I was just saying, where they come in, they're smart. They definitely know what they're talking about. And so smart that sometimes they are set in their ways as far as how they want to do things. And to trust someone to come in and ask you to maybe do something a little differently
Mhm.
is challenging for them. So that's where I, as a producer, have to understand, okay, this change may not happen tomorrow, but with enough time and developing enough trust in the relationship, they will relax and take instruction. And I saw that with Dr. Plotkin. In the beginning, the podcast was just him. He just wanted to talk about his points, and he knows he's an ethnobotanist,
Oh,
world-renowned ethnobotanist. So he knows what he's talking about. But I gradually got him to invite other guests on. And so he learned how to share the mic, share the conversation. And we got great content. It was great storytelling. And it was like listening to two friends having a conversation.
yeah.
And it worked out so well. So, over time, he relaxed into it. He trusted me, and we got to the place where the podcast was able to grow in different ways.
Hmm. Yeah, I know a few people that do. It's just themselves, kind of,
Mm-hmm.
broadcasting or podcasting in that way. And as you mentioned, it's a great way to consume content because you can do that
Mm-hmm.
on your time. You can choose who you listen to and learn from. But I don't know how much people would want to hear me just talk by myself. But I think it's very powerful that you do have those platforms now
Mm-hmm.
to kind of do some of that solo work and spread the message.
Yeah. Yeah. And it's hard to do it by yourself. I mean, it's a lot of kudos to you. It's hard to do it by yourself. So I explained to Dr. Plotkin, I said, sharing the mic is not a bad thing, and you're bringing that person's audience in too, so you're getting a whole
Mhm.
new audience. So it's a give and take. There are benefits to it.
Absolutely.
Hmm.
Can you share a transformation story, either an individual or maybe an organization you are working with, that illustrates the power of intentional leadership?
Mm.
We talked a little bit about that kind of throughout.
Well, I've been talking about Dr. Plotkin is the president of the Amazon Conservation Team.
Oh,
So they've had some really great transformations as far as what they're doing with work in the Amazon. As far as he was a great leader before,
hmm,
but I feel that the podcast has given him a broader audience,
hmm,
have brought more eyes onto his cause.
hmm.
So I would use that as a great example.
Okay. Yeah.
I would use that as a great example.
Hmm. So, most of your work focuses on elevating leaders through self awareness, as we've talked a lot about, communication, and then inclusion. How does that inclusive leadership, in your experience, directly influence an organization or a leader's ability to attract top talent, retain those high performers, and really cultivate a healthy, high functioning culture?
Inclusivity is something that, if I were going to work for an organization, that's what I would be looking for, because you're hoping that that represents the audience. You're always thinking about who your audience is. And if you're working with a diverse community, you want the people who are on your team to be a reflection of your audience. I know that that's important for me going into an organization. I look around, it's like, okay, will this organization understand my concerns or my audience's concerns? And so you want to be able to feel as though, okay, again, I'm included, they are open to hearing. And that again goes back to feeling safe, feeling as though you can speak and be heard, and that they are interested in the diversity that's in the audience that they're serving.
Hmm. That's a key point, especially for the recruiters listening. We talk a lot about it at APPR and other, webinars and educational components that, really looking at the community those physicians are serving
Mm-hmm.
and making sure that they're a reflection of that community. Because as the key word you said within that is safe.
Mm-hmm.
And we know patients don't go, they don't seek out care if they don't see it's reflected within the hospital and health system that is there.
Oh, absolutely. And I still know people who will only go to doctors who are of color, who are African American. And so you would hope that your organization can help them, that they serve that need.
Right. One of the most powerful stories I had in my recruitment career was being able to place a Spanish speaking physician in a community that had never had that for primary care. And I followed up with
Mm.
him, maybe 90 days after he'd been there, how is it going? And it was amazing to hear the stories of people who had not reached out for care because they had that language. That language was a barrier. They did not feel comfortable. And so it made a huge impact in that community.
Mm-hmm.
Not only was he immediately busy, but he found, he kind of found that connectivity and that purpose of serving somewhere where, again, they didn't have somebody who met what that community actually represented.
Yes, exactly right. Yeah. As I was saying earlier, my mom's caregiver, one of her social workers, she's bilingual, and they
Uh-huh.
took her off the case because she needed to move into a community where there were majority Spanish speaking people, and she needs to be able to translate for them. And so, yeah, it's definitely a concern and something that all organizations should be aware of and keep in mind as far as inclusivity and yeah.
Yeah. So you're known for connecting strategy with humanity.
Yes.
How do you help leaders stay grounded in people first practices when they're facing organizational pressure, rapid change? We know that the cost of doing business keeps going up. How do
Mm-hmm.
you help them do that?
You know, I ask them to come to me with their goals, what they hope to accomplish, what's not working for them, what is working for them. And then once we can sit and focus on that, we talk it through, come up with a script, and record it. We really do. We put it out there because they need to sometimes hear themselves saying it to remind themselves of what's important to them. And then they use that information. And it's empowering in a lot of ways.
Mhm.
So even if it's no one sees it on in the public world, it's something that they have and they can listen to and remind them. Sometimes we're having conversations and the best and most important information comes out in that conversation, just casual conversation.
Right.
That's what you record and then you play it back and you hear that. It reminds you of what you need to stay focused on. And maybe you need to change the job. You never know. Maybe you do.
Right. Right. So as we start to wrap up, I'd love it if you could leave our listeners with one leadership practice that creates immediate impact. What would that be?
I would say be intentional in what you want your audience to know. But most importantly, know your audience and be clear about why you want to talk to them and what is the message that you want to leave them with.
That's good. I think that is great.
I do want to tell you, I'm going to have a webinar series early part of 2026, aiming for January. But if anyone is interested, it's free. And it's really a breakdown of the video method and helping people to get comfortable being on camera, explaining why they need to have video, steps to get comfortable on camera, and how they can use video. So they could follow me on my different platforms. That would be great. And then they can get the information about when the webinar will be.
Yeah. Can you give us the breakdown of the acronym video?
How did I know you're going to ask me that? Okay. So V is for visibility. You need to have clarity. You need to be visible. So you need to have your brand. Everyone, I believe, should have some type of video to represent their brand, build out their personal brand. Then you have I for intent. So you need to be intentional in what you're putting out there. Why are you creating this video? What is the message that you want to do? Do you want to attract new opportunities? Do you want to clarify who you are and what you offer to your patients? You want to educate your patients. So that's part of the I. Then you have the D, which is delivery. How you get comfortable on camera, messaging, getting focused in your messaging and what you're going to say. As far as doctors, don't get too technical. Use layman terms. You need your audience to be able to understand you. And I used to, when I would prep guests for the TV show, 3 minutes, they have 3 minutes for a segment. That's not a lot of time.
No.
And sometimes they would get very caught up. And I say, no, you have to speak simple. So that's D. Then we have E, which is engagement. So once you create the video, you're going to post it. You're going to put it out to your audience. You're going to send it out, have a website where you post it so your audience can engage, ask you questions. You always have a call for action where you're inviting them to ask you questions because that's the whole point, for them to get to know you, you to get to know them. And then you have which is to optimize the video. Once you create the video, you repurpose it. You can use it in different ways. You could post it. This long form video that you're creating here, you can edit it down. There are AI tools that you use to edit it down so that you can post it on the different social media sites. You can post it on YouTube Shorts. You can put it on TikTok. You can put it on Facebook. So you optimize it. So that's where you save time, because you're creating long form video, which you can repurpose and be cost effective and efficient with your time.
No, thanks for that. I do have a team behind me helping me, but that is great advice if people are looking to get started and create that video presence.
There you go.
Yeah. So on behalf of myself and PracticeLink, I want to extend a sincere thank you to Debbie for joining me today on Workforce Wisdom. Your insights into leadership, culture, and building inclusivity remind us of the essential role of that human-centered strategy in all aspects of what we're doing in the workforce. For our listeners, you can learn more about Deborah's work, coaching, and consulting services by connecting with her on LinkedIn or visiting her professional website, deborahmitchellmediaassociates.com. If you're looking for additional recruitment or leadership resources, be sure to explore the PracticeLink Resource Center at practicelink.com. As always, I welcome your questions, feedback, and ideas for future episodes. You can reach us at plmedia@practicelink.com. I'm Christy Bray, and this has been Workforce Wisdom. Thank you for listening. I look forward to bringing more conversations that inspire, inform, and transform the future of healthcare recruitment.